going to do a gross anatomy of the inner thigh muscles. So here in our book, on this page here, you can see that the group of inner thigh muscles, again called the adductor group, is sandwiched between sartorius, which we learned about in the hip flexor video, and over here is the inner hamstring muscles that we learned in the back of the thigh video. So in between those two muscle groups lies the adductor muscles as a group. And this is what we're going to learn about. Now, on this page here, you can see that all of the adductor muscles, except for one, attach in the pubic bone area. The one that doesn't attaches to your sitting bone. So that's called adductor magnus. Now, in terms of where the muscles lie, here is adductor magnus, which is sandwiched between the front of the thigh muscles and the back of the thigh muscles. So this is the back view. This is the front view. Over here is the adductor longus, which is actually a cord-like muscle. And so when you want to feel that muscle, you just bring your leg upward and resist at your knee, upward and inward, and there'll be a cord-like structure near your groin area. That is adductor longus, and that's also the most common muscle that gets a strain or a tear. The other one is gracilis. This is a strap-like muscle. It's probably very close to your pubic symphysis on the pubic bone and travels downward and then attaches to the inner shin bone where the other two muscles, sartorius and semitendinosus, in the pes anserine area. Pes anserine is Latin for goose-like foot, the way that it attaches with the other muscles. So those are the three muscles that we are going to concentrate on. Now, some other pictures. Here is another view of gracilis, which is a strap-like muscle, moving down towards the shin bone, inner side. So this is an inner view. And over here is adductor magnus right here. And then in the other picture, over here, you could see here's sartorius, here's semitendinosus, and here is gracilis attaching on the inner shin bone area. Now, the reason I always comment on this area gets sticky a lot, it gets adhesions, so we need to help relieve some of that stickiness there. Here is adductor magnus right in that area as well. Now, another thing on this picture here, this is the back view. So we've talked about the hamstrings. We talked about the glute maximus. We talked about TFL attaching to the IT band along with glute maximus. And now here is gracilis and adductor magnus. So tight areas or sticky areas are all along the gluteal area going to the TFL, so that thigh bone area, as well as in the hamstrings. In this area becomes very sticky, along with vastus lateralis and biceps femoris. And then over here, it also becomes sticky with the medial side or inside hamstrings in adductor magnus and gracilis. And then becomes sticky again down near the knee area where all the tendons join up. Now we'll move to Frank to give you a visual on the skeleton. So with Frank here, this is the pubic bone here. So gracilis attaches very close to the pubic symphysis and travels downward in a strap-like motion, and then attaches to the inner shin bone here with the other two muscles. Adductor longus attaches here and moves downward and outward to attach to the thigh bone. Again, it's a cord-like structure, very palpable, or you could detect it very easily compared to the other adductor muscles. And adductor magnus, as I mentioned before, attaches to your sitting bone, and it's very wide, so Magnus means big. It goes all the way down and attaches right about here. Now, all the adductor muscles, except for gracilis, attach to the thigh bone. So gracilis is a two-joint muscle, attaches up here and passes the knee, whereas the rest is basically a one-joint muscle. And now we'll move to massage techniques for the inner thigh.